Hello friends. This video has been adapted from the very interesting book. The book's name is Feeling Good. It's a highly recommended book and is written by a psychiatrist, Mr. David Burns. And this presentation is an interesting presentation on recognizing the common mistakes in thinking, or as you call is thinking traps, which are responsible for many psychological problems like depression, anxiety, and emotional suffering. So that is what is called as the cognitive distortion, and we will be looking into that concept in a bit detail. For a deeper understanding, I would recommend the book to be purchased and read in toto. So, different ways of problems in thinking, as you call it, as a cognitive distortion. So, one of it is all or nothing thinking. In this category, the personalities who fall into these categories, they have a habit of evaluating themselves in extreme, means in black or in white, with no shades of gray. So, for example, if a student in this category gets a result and he fails in a particular course, this category of a student who has a distorted thinking, he would perceive it as the one like a total failure. So he would feel that he is a zero, he is all for nothing. So this way of looking at the problems which one encounters, that is categorized in the distorted way of thinking, and that is the personality who aims for perfectionism. Means such personalities would always aim for perfectionism, and any small mistake they commit, they would take it as being a complete loser. So this way of thinking in black and white, as if no gray shades exist, that would be a wrong way of thinking, because that would create a lot many psychological problems. Because absolutes do not exist in the universe, according to Dr. Byrne, and forcing experiences into absolute categories often leads to constant disappointment and self-discrediting. Okay, so if a personality looks into black and white, that is to be corrected. The second type of cognitive disorder or personality can be called as the personality who generalizes many things. As an example, let us say that there is a salesman, and the salesman sees some bird dung on his car. So, if that salesman then generalizes it and says that the birds are always crapping on my window, that would mean that this personality is having some distorted way of thinking. Because if one looks rationally at that example, then it could be an event. Okay, the event that a bird comes and there is a dung on his car. Okay, so over generalizing it, despite the fact that that salesman has experience of 20 years of travel, and this has not happened with that frequency, that the problem is not with the bird, the problem is not with the event, the problem is with the manner in which the person is thinking. Similarly, if a boy is rejected, okay, during when he proposes a particular girl, right, and this happens, let us say, only once, and this person generalizes it and says or concludes that no girl would ever want to date with me and I will be lonely all my life. So this kind of generalization would cause a lot of pain of rejection, and that hardly is a rational way of thinking. So this category is, or distorted way of thinking is called as generalization. Uh, the third distorted way of looking at it is having a negative perspective or negative filtering of the things around you. For example, uh, as an example, if a student who misses 17 out of 100 exam questions, and if he or she feels that she would fail, now attempting not attempting 17 questions of 100, a rational person would think that okay, so a student might have scored less marks, that's okay. But this person with the distorted personality uh, would conclude that this single negative detail is as if the entire situation is negative. There is a single negative detail, and the student would say that the entire situation is negative. So when the student receives the grade, let us say 83 out of 100, and maybe amongst his or her peers, the student gets A plus grade. Now the problem was not his exam or her exam. The problem was the single negative detail on which that person was obsessed with and couldn't see the positives. So when depressed, generally, people wear special lenses that filter out anything positive, according to Dr. Burns. So because you are unaware of this filtering process, you conclude everything as negative, and hence this selective abstraction causes needless pain, needless anguish. So this is a third distorted way of or category of thinking which a person might have. A very destructive cognitive distortion is what is disqualifying the positive. Now, what is this? So, as an example, we all know that the medieval era alchemists, they dreamt of turning base metals into gold. So, the thought of creating value out of nothing. This kind of distorted personality is exactly the opposite. So these depressed individuals would do exactly the opposite. So any joyful event they experience, they would kill it by their emotional lead, often without realizing it. So suppose somebody praises your work, and you just tell that they are just being nice. So that is a distorted way of thinking, because actually you are, suppose that person is being appreciated, but a depressed person would not feel that he or she is being appreciated, he or she is being praised. He would simply say that they are just being nice. So mentally disqualifying the compliment with one swoop blow. The other example is, let us say that there is a woman who is hospitalized, and she keeps on insisting that no one would care for her. And let us say that in that hospital, so hospital staff and the fellow patients, they express fondness. If she comes with the conclusion that they don't count, they don't see me in the real world, then there is an extreme case where the positive events are not being appreciated. One, the positive events which are happening in the life are not being appreciated, and you are just looking at the opposite, instantly killing the joy. So, this is, according to Dr. Burns, the most destructive cognitive distortion because it removes life's richness and makes things appear needlessly bleak. The fifth category of individuals or personalities or thinking distortions is jumping to conclusions. In this category, the person has a habit of arbitrarily jumping to a negative conclusion and arbitrarily jumping to negative conclusions without looking into the facts. Uh, so, as an example, you can take that you assume that you are looking down on you without checking. A friend passes you and without saying hello, and you conclude that he is not liking you anymore. So, it might happen that a friend of yours is not saying hello because the friend was absorbed in some thought. But without looking into the fact and without understanding this reality, if you conclude that this friend is not treating you well, is not liking me anymore, so such kind of mind reading without actually looking into the facts is basically you are jumping to conclusions, and that is highly negative trend. As an example, Dr. Burns gives you an example where you predict misery as a fact. A librarian, in his example, repeatedly told herself during anxiety attacks that I am going to pass out or go crazy. Now, this is a very depressed personality where she is trying to create or trying to tell her future without actually she being facing this kind of scenario. Okay, so a depressed position or a depressed person would give up his practice believing the word would be depressed forever. Okay, so this rapid improvement after therapy shows how off base a fortune telling has been. So basically, it all depends on the thinking pattern. The cognitive distortion of jumping to conclusions because without looking into facts, okay, that is the distortion according to Dr. Burns. This is a very interesting distortion discussed by the psychologist, wherein he calls it as the binocular trick. And you know that binoculars basically gives you a picture which is of a different proportion. So in this, the personality, the distorted personality, either magnifies or minifies the reality. So you either blow out the things out of proportion or sting them. So if you are blowing out, so what is being blown off is magnified. What is being magnified is the catastrophe. So, my God, I made a mistake. How terrible. My reputation is ruined. This kind of conclusion for a small error. So, a person commits a small error and he or she magnifies it, saying that, oh, I have made a terrible mistake and my life is ruined, my reputation is ruined because of that. That is basically you are making that small error look like gigantic and grotesque. On the other hand, maybe that you have certain strengths, positive strengths, okay, and you are looking through the long end where your good qualities are appearing small and unimportant, okay. So you get a feeling of inferiority. So maybe you are good at something, and you then would say that okay, but they are not worthy qualities, right? So this is now you are minimizing the good qualities which you have. So this is a distorted way of thinking, which is called as magnification and minimization. The seventh distortion, which was discussed in this book, which I mentioned, is emotional reasoning. So, Let us take an example wherein a person says that I feel guilty, therefore I must have done something bad, or I feel overwhelmed, therefore my problems are impossible to solve. I am not in the mood, so I might as well stay in the bed. So, this kind of reasoning, emotional reasoning, okay, where you avoid the task because they feel impossible, means the tasks are simple, but you are avoiding them because of the problem of your emotional reasoning, where you would say that this task is impossible, right? And if you actually come out of that problem, and if you see and look at that problem 6 months later, say, you finally think and say that they were quite manageable. So why has that happened? That has happened because you are letting the negative feelings guide your actions all along. Okay, so your emotions are taken as evidence for the truth, okay, which is not the fact. Emotions are just emotions. You should not take it as an evidence for the truth, right? Because that is a distorted way of thinking. Again, one more distorted pattern which comes in the people is the shouldy approach to life. Now, what is this shouldy approach to life? Telling yourself that I should do this, I must do that, and when you keep on doing that I must do this, do that, and you actually don't do, and you end up feeling pathetic, okay, and unmotivated. Now, this shouldy approach is because you are directed inward and not directed outward. So you keep on telling yourself that you want to do this, you want to do that, but you don't act. Okay, so this creates self-loathing, shame, guilt when you fall short of your own standards. And towards others, this personality generates frustration, bitterness, self-righteousness when others inevitably fail your expectations. So this should statements is basically the distorted pattern of thinking according to Dr. Burns. This labeling and mislabeling is another error of thinking. Personal labeling means creating a completely negative self-image. Uh, Again, maybe because of overgeneralization. The philosophy, the measure of a man is the mistakes he makes. So, suppose you keep on labeling yourself as I'm a born loser, I made this mistake, I'm a failure. Okay, this labeling yourself or you are labeling others that this is an uncooperative bitch, is an insensitive chauvinist. All this labeling businesses, it creates a destructive cycle, right? Because you as an individual is then locked into this labeling and mislabeling and describing events with inaccurate emotionally loaded words, and that is basically going to create a lot of distortions and lot of psychological issues in the individual. So avoid labeling and mislabeling for a better or clear thinking pattern. This 10th, personalization, where you assume responsibility for negative events when there is no basis for doing so, is called as the mother of guilt. So, as an example, let us say that when a patient didn't complete a self-help assignment, the doctor is feeling guilty, right? And the doctor is concluding that he is a lousy therapist. It is his fault that the patient is not working, right? Or if a mother sees her child's report card and looking at her grades, if she is concluding that she is a bad mother and this shows that she has failed as a mother, so that is the mother of guilt. So this personalization error is often very problematic because you as an individual has confused influence with control. You can influence others, but what ultimately you do is your own responsibility, not yours. So, this has to be understood as an important psychological distortion, the way of thinking. So, all these 10 cognitive distortions, black and looking at the reality in black and white, this thinking pattern, and not appreciating the gray things. One event you take and generalize it as if it is going to predict the future, or the focus only on the negatives, ignoring the positives, ignoring successes, uh, mind reading and fortune telling, often concluding that the future is bad, blowing the things up, emotional unreasoning, or taking the feelings and facts rather than looking at the facts, and thinking with must, that is, you should do, you must do, and if you are not doing it, feeling frustrated, putting a negative self labeling on yourself or negative self labeling on others, and finally taking the blames on the things which you cannot control. All these are cognitive distortions, according to the well known psychiatrists. So, if you are recognizing this distortion, that is the first step towards challenging them, and then coming out of that, curing yourself, and forming an accurate, balanced perception of yourself and the world. Thank you.